Hi, welcome to IAN's Health Talk with Dr. Akram. I am Akram. In this program, we'll be talking about all different health issues with different experts in the field. Today, we'll be talking about urinary incontinence. So sit back, relax, enjoy your time with us. Urinary incontinence is the involuntary leakage of urine. It means a person urinates when they do not want to. Control over the urinary sphincter is either lost or weakened. Globally, up to 35% of the population over the age of 60 years is estimated to be incontinent. 24% of older adults have moderate or severe urinary incontinence that should be treated medically. Bladder control problems have been found to be associated with higher incidence of many other health problems such as obesity, diabetes. Difficulty with bladder control results in higher rates of depression and limited activity levels. Urinary incontinence is more common among women than men. An estimated 30% of females aged 30 to 60 are thought to suffer from it compared to 1.5 to 5% of men. The management of urinary incontinence with pads is mentioned in the earliest medical books known, Erebus Papyrus, 1500 before Christ. Incontinence has historically been a taboo subject in Western culture. However, this situation changed when Kimberly Clark aggressively marketed adult diapers in the 1980s with actor June Allison as spokeswoman. It was her mother who had incontinence convinced her that it was her duty to enlighten the public. The adult diapers proved a success. But for the time being, let's look more in detail about symptoms, signs, treatment, and if we could prevent the condition. For that, let's welcome our special guest. He is a consultant gynecologist. He has special interest in treating patients with incontinence. Dr. Fadi Al-Fiali.
Hi, good evening.
Fadi, welcome to our show. How are you today?
I'm fine, thank you very much. Thank you very much for inviting me. It's my privilege, my pleasure to join you today in your program.
Fadi, it's a very interesting subject we're talking. Sometimes not many people want to talk about it, but there are a lot of people. A lot of my viewers are waiting to hear this subject because it's an important subject, and people are sometimes, they don't feel comfortable talking this. But at least we're going to give them a good overall view about this condition. But before that, let me tell the viewers, this is a live program, guys. So you can call us on 0203 515 5788 if you have any questions or suggestions, or write to us healthtalk@iantv.co.uk. And you can also follow us on Twitter and Facebook, IAN Health Talk with Dr. Akram. And of course, you can watch us on Facebook Live, iantv.co.uk. Fadi, back to you again. Sorry. Would you like to tell something about you and what you do, like how is your lifestyle and things, what we would like to hear from you.
Thank you, Dr. Akram. Indeed, the topic is really very interesting and very important topic. So my name is Fadi Al-Fiali. I am consultant gynecologist obstetricians. I work in Colchester. This is east of England. I've been in UK for almost 17 years now. I have been doing obstetric and gynecology for almost 29 years. I am a little bit more specialized, or I have a special interest in urogynecology, dealing with leaking, dealing with prolapse. Also, I have some special interest in what we call ambulatory gynecology, so dealing with abnormal uterine bleeding. And I have also an obstetric special interest in medical complication in pregnancy. So I deal with a lot of pregnant women with cardiac disease or diabetes or other medical disease. I'm a married man. I have two daughters going to uni this year, both of them.
Two daughters going to uni?
Life, yeah.
What are their names? So what are their names, Fadi?
My daughters. The eldest is Mireille. She's going to do medicine as a second degree in St. George's, and the youngest called Joelle, and she's going to Queen Mary. She's doing politics and international relationship.
That's an amazing combination. Okay, excellent. That sounds very good. And I know it look like you have a quite busy life and you're doing lots of different things in obstetrics and gynecology. And
Indeed.
this is a really important subject. And a lot of viewers had been asking me to bring an obstetrician and gynecologist. And even from the time we started, a lot of people had written to me as well. So finally, I got someone here on the show. Okay, let's talk about urinary incontinence. Okay, what is this about?
So urinary incontinence means involuntary loss of urine, and this is a very common social hygienic problem, which we can demonstrate objectively. So we would see the leaking in our eyes. The problem here, it is untreated, unreported. Patient may feel reluctant really to initiate discussions about incontinence. They have embarrassment, they lack knowledge, they have some fear about surgery. They are very reluctant to come and seek medical advice. It is reported that it's only up to 60% of women with leaking problem that will come and seek really advice about their leaking problems. And even this 60%, it's only like a quarter of them, it's only 27% of them that will remain on treatment because of the fear, because of the anxiety, because of really the lack of knowledge about this process itself.
Okay, that's good. I think we have prepared a special video for that. Let's have a look at that. So it will be more animation, and we can explain it more detail in the following segments. Okay, we're waiting for the video and.
This video is designed for caregivers of older adults with dementia who have urinary incontinence. Urinary incontinence is defined as any leakage of urine or inability to get to a toilet in time. If your loved one has new urinary incontinence, discuss it with a doctor. There may be reversible causes, such as bladder or kidney infection. In men, history of prostate cancer with radiation or surgical treatment can be a cause. In women, decrease in strength of the pelvic floor muscles and an overactive bladder are common causes. The following are some strategies that might help to decrease incontinence episodes. Timed urination, or timed voiding, can help regulate your loved one's use of the bathroom. The goal is to prepare your loved one to use the bathroom on a regular schedule. However, this can take time and effort. Start by providing gentle reminders to your loved one to use the toilet at short time intervals. If your loved one is using the bathroom or having accidents every 2 hours, start out by deliberately reminding her the opportunity to go to the bathroom every 2 hours. Gently lead her to the bathroom and encourage her to use the toilet, even if she does not initially feel the need to go. After a few days, stretch the time interval between the trips to the bathroom by 15 to 30 minutes. Eventually, your loved one may be able to extend the time between bathroom trips to 3 or 4 hours. Remember that time voiding will not be successful overnight. Do not argue with an older adult who does not want to use the bathroom, but instead use gentle reminders or commands, such as "let's go to the bathroom," rather than asking. This technique may not work in older adults with very advanced dementia who can no longer respond to requests, and may increase agitation due to their inability to understand what the caregiver is asking. Getting up to use the toilet at nighttime can increase the risk for falls and disrupt sleep. For safety, remove all obstacles such as rugs that might make the ground uneven. Set up motion sensor night lights to help your loved one see in the dark. If possible, move the bed so that your loved one can see the bathroom from the bed. Consider painting or labeling the bathroom door. Disable locks so that your loved one cannot accidentally lock herself in the bathroom or bedroom. Some older adults who suffer from incontinence or frequent urination think that decreasing their fluid intake will decrease their need to urinate. However, drinking enough fluids is important to maintain metabolism and kidney function. Do not deny your loved one liquids if she complains of thirst. Avoid liquids that are bladder irritants, such as tea, coffee, or sodas. Also avoid drinking fluids near bedtime. Go over your loved one's medications with a doctor. Some medications can increase the need to urinate, such as diuretics, commonly known as water pills. If your loved one must be on a diuretic, consider changing the schedule to nighttime when your loved one sleeps. If nighttime urination is a problem, then take the diuretic during the day and use the toilet on a schedule. Urinary incontinence often leads to fear of having an accident or not being able to find a public restroom outside. These fears can lead to social isolation and depressed mood. Don't let this problem keep your loved one at home, but do take steps to prepare for incontinence outside of the home. Using disposable garments such as pads or diapers may allow your loved one to feel more secure about leaving home. Pack a bag with a change of underwear and clothes, disposable wipes, and extra pads or diapers to ensure that your loved one can clean up easily in the event of incontinence. There are also various cell phone applications that can locate the nearest public restrooms that may help reassure your loved one. We hope these tips have been helpful. Talking to other caregivers of older adults with dementia may give you other helpful tips on preventing and managing incontinence. Consider joining a support group for caregivers. Many older adults suffer from incontinence, so you and your loved one are not alone.
How common is this condition, Fadi?
It is really very common, and the prevalence of this disease depends on the population we study. But overall, the overall prevalence of incontinence in a young lady, a non-pregnant lady above 20 years old, could be reported between 10 to 17%. Recently, there was a data came from UK. It says from UK national health data, almost like it's expected 6 million people will have some kind of urinary incontinence.
6 million people in the...
6 million, yeah.
Wow.
The USA national data, which was published between 2000 to 2014, it's estimated that 9.6 million of women over 50 will have some experience of stress or urge incontinence.
The condition is quite common, isn't it? Even though we don't talk about it.
It is very common, and the prevalence increases with age. So I said 10 to 17% in a young lady, but if you take women over 65, the prevalence will be above 50%.
So how common people come and ask for help from you? Is it very common?
That's the major problem. The two concepts which we are struggling in dealing with women with urinary incontinence. A lot of women, they view that this leaking is a normal part of aging, which is completely wrong.
So this is not normal part of the aging. This leaking can be treated.
Yeah, and it is completely misconception that we cannot do anything, because a lot of them will say, oh, I have a little bit of leaking and nothing can be done for this one. It's completely wrong. We should not view this condition as a condition we cannot. We have a lot of things we can do. The problem is underreported. Women will really feel really uncomfortable to disclose their urinary symptoms.
So it will be probably even to
GPs, I mean.
Yeah.
And for example, there's a study done recently in Italy which showed almost 43% of these women will only be comfortable to disclose these symptoms only if the primary health provider brought this topic to them. Otherwise, they will not talk about it.
Do they talk this in the family, at least with their partner, or they could alert them?
I would probably assume not really, because they will feel embarrassed, they will feel shame, they will have anxiety about talking this one, because they feel that these people will be rejected from the relative, rejected from other people. Unless you have a very close person to you, they may not talk to you.
They may not talk. Fadi, let's join us a caller, and
Okay.
we'll go ahead with the subject. Hello.
Hello.
Hello, welcome to our show, sir. What's your name?
Hello, good evening. My name is Mia.
Yes, sir. Go ahead.
I have one question, Dr. Akram.
Yeah, thank you.
I am diabetes patient and I suffering now. Diabetes, my sugar level come too much up, and my age is now 56. And diabetes, I have 8 years now. I take medication. And last 4 months, my BP have increased my medication. The glycoside, this tablet for sugar. Before I take 40 milligram, and now give me 120. And I take now 2 months. And now is 3 weeks. I see. I take this medication timely and every day, and my sugar level come too much up. And yesterday, I must call 111 in the night, come over 20. And I diet too much now for 6 months, and I know eating too much everything, before I eating some fruit or with milk, tea, or some biscuit. And I take
yeah, understand your worries. So it's something about diabetes. Are you talking about? Is that right?
Yeah.
Is diabetes control? Do you have any problem with the subject we are talking today?
No.
No. What if you don't mind? What we could do, if you could write us all your symptoms, or you could call me when we're finishing the program by 8:30, you could call us to the studio, and I'll have a chat with you, because we're talking about urinary incontinence today. And if you have anything to do with that, we will be able to answer, especially my guest. He's a specialist on that. Probably we'll continue with that talk, but thank you for calling us. Do write to me. You can write on the email, or you can write me on the Facebook, or you can call us after 8:30, and I will handle your problem. Is that all right?
Thank you.
Thank you very much for calling us. Fadi, let's go with, I'm sorry for the interruption.
No problems at all. The main problem is to report these symptoms, and this is why I always advise, when I have some talks with our primary care provider, yes, it may take another extra 2 minutes in their consultation, but it's very important to have opportunity to really explore these symptoms, because the first line of management of all these leaking problems start with the primary care. All the conservative management or life changes can start with there, and that could be really a changing of
what
their
kind
life.
of signs and symptoms we expect in this condition?
Okay, if you allow me, I will talk a little bit about some definitions which will help us to understand what signs and symptoms which we could see in these patients with urinary incontinence. So there's something called urgency. Urgency is that strong desire which women cannot defer, strong desire to wee, she cannot defer. And if she cannot really go to the toilet, she will lose urine. And this is...
that's called urgency.
This is the urgency, but we need to understand this is slightly different from the first urge in a normal process. So our bladder capacity, for example, in men can accommodate 600 mL, and women they have less bladder capacity. They can accommodate only 400. But when we reach third of that bladder capacity, we start to feel we need to go, but we are able to control that. Urgency is slightly different. Women cannot control, and if she cannot make it in time, then she will leak. Urge incontinence is that leaking, involuntary leaking, which is immediately preceded by urgency. There's another term called frequency. This is how common or how many times we go, how often we go during daytime to the loo, which is a normal process. We can really go up to 8 times in a normal way. Women with overactive bladder or urge incontinence, they go more than 15 times per day. They cannot make it because they have reduced bladder capacity. Nocturia, usually how often we wake up during the night and we go to the loo. And usually it is normal to wake up once during the night up to 70 years old, and above 70, every 10 years we will add another one. So we have some element of these symptoms, but in a normal way. If they are really excessive, then we start to have some problem. So usually when I see women in my clinic, the first things I will do, I'll take the story, I'll take the history, and I'll ask about these symptoms. So they come with leaking when they cough, when they sneeze, when they do exercise, or they come with leaking, for example, when they have strong desire and they cannot really hold. And these symptoms can be more worse in winter, or if they hear the water running, or they will tell you, usually they come immediately from supermarket or wherever where they have been, and they put the key in the door and they rush to the toilet. This is some kind of what we call urge incontinence symptoms. So sometimes these symptoms can be associated with some voiding problems. They don't empty their bladder, or painful bladder symptoms. They have pain, they have blood in the urine. So these are the usual really symptoms which are associated with all these problems.
Let me summarize. So we talk about urgency, that they can't hold the urine for longer time or for the normal time. Usually, you said it's they go during the daytime. You go to the loo for about 8 times a day, and that is that right? And then the next one is the frequency.
Normally, it's up to 8 times.
Yeah, frequency, they go more than 8 times, and sometimes in the night. It's normal probably to go once in the night to go for a loo, but it's when you say it's nocturia, it's like they pass more urine in the night. How many times they?
So once normal, once up until we are 70 years old.
Yeah.
And above 70, every 10 years you could add another one. So if
once or twice
is like 80 and her 80s, twice would be normal.
So yeah, once or twice is normal. If they go more than that, it's abnormal. And we talk about cough and sneeze, and when you cough and sneeze, you leak urine. So these are the condition. They have to seek for medical help, and this is a condition which is treatable, isn't it?
Absolutely. There's many things we can do for them. Of course, depending on the type of the leaking, there's different types. We probably will talk about them later on, but depending on the type, we can really individualize each treatment for each patient.
Exactly. So anyway, we have a good start. We explained what is urine incontinence, how it happens. Today we're talking about urinary incontinence, and for the first half we talked about how does it affect your life and what is urinary incontinence, and we especially talked about urgency, frequency, nocturia. These names sound a bit medical, but they're not medical. Urgency means you can't hold the urine for too long, and the frequency, you go more than normal. Daytime it's 8 times, or if you go more than 8 times, it is called frequency. And nocturia means you go more times to urinate in the night. Normally it's 1 or 2 times normal. If it's more than that, that's abnormal. Then also the other 2 other conditions we talked about, cough and sneeze, and if you leak urine when you do that, you need to get medical help. Let me welcome our special guest, Fadi Al-Fihali. Fadi, welcome back to the show again. Okay, let's talk about risk factors. Who are the people with this kind of risk factors?
All right, okay. It's very important questions. Indeed, everyone can have urinary incontinence, both men and women, but of course there's some risk factors. So age, one of the risk factors, although age is not independent, because when we get older, we will have other comorbidity which can cause some leaking problems. So the prevalence of incontinence increase with age. Now, obesity, increase in weight is a strong association for stress incontinence. Less really certain about really overactive bladder or urge incontinence. And studies showed that if we do even some surgery to reduce weight, it is associated with 50% reduction. Almost half of our symptoms will be, half our patient will have no symptoms of stress incontinence.
Just losing the weight helps reduce
Yes.
this stress incontinence. Okay.
Absolutely. Now, there's a lot of talk about pregnancy, delivery. I'm talking about mainly women now here. So increase in the number of pregnancy is a strong factor for what we call prolapse and incontinence itself. This is also not the independent, because we do see leaking problems in women never had any pregnancy before. So it is not only a strong associated factor. Mode of delivery, a lot of you could see a lot of really pregnant women comes to you to say, oh, I want to really have some protection. I don't want to have a normal vaginal delivery, and they go for, they will ask for cesarean section. It's quite common request these days, but they have to understand that cesarean section itself is not protective against urinary incontinence. Family history does play a role, and twin studies showed that people, twin people, they have, like in overactive bladder, they have 30 to 50% increase in risk of having incontinence. Ethnic minorities or ethnic or race, it's not really an independent factor, but we know that it's more common in white women compared to African American women. I think probably the three major problems in increasing the risk factor of urinary incontinence is chronic cough, chronic constipation, and doing a vigorous heavy lifting exercise. These are the three most common ones we need to really be aware of them.
Okay, so it's more common in aged people and obesity, high weight, and if you had a cesarean section, it's not. It will not prevent it. It might increase or it might not. It's quite same.
Yeah.
And chronic cough and a few other things we talked about. That's good. That's good. And how does it impact in their life?
It is really affecting significantly the life of these patients. They have a lot of really psychological problems. They feel guilty, they feel depressed, they feel really embarrassed because of the smell of the urine. They lost their self-respect, they lost their integrity. They restrict their social activity. There's a term called mapping. These women will not go outside to town center unless they really map each toilet in the town center. In case something happened, they have to find really the toilet very quickly. It does have like increased risk of medical problems like infection, soreness from the perineal area. It does have some problem even on their work. And if you look into the studies, it's reported like 7% of women and up to 26% of men who had leaking problem, they went for early retirement. Wow. It does affect some their sleep, so they have sleep disturbance. And one of the really interesting things when I was dealing long time ago about urinary incontinence, when I was looking, it is associated with high risk of falls and injuries in elderly women. So these women have more risk of fall and injuries and bone fractures. And the link is by if you have an elderly woman with unsteady gait and she's running from the stairs down to the toilet yeah. And she's not steady, she fell over and she will have more risk of fractures of her long point.
So do they have to feel guilty about it?
Absolutely no, because it's not. It's a common, and if you look to the prevalence, it's very common. If you take above 50, 60 years old, it's 50% of these people will have it. It is as any other condition. We can do something for it. We just need to know your symptoms, the patient's symptoms, and then we can deal with it.
We can deal with it, isn't it? So they don't
Absolutely.
they don't have to feel guilty. Of course,
we have a lot of options. We have a lot of medical treatment first-line treatment and we have surgical treatments. And the surgical treatment for stress incontinence is associated with very high risk of cure rate. Up to 90-95% we can cure stress incontinence with surgery.
Let's talk a little bit about how we can manage this condition.
Okay, so the management really depends on the type. So there's different types of leaking. There's stress leak, there's urge leak, and sometimes women have both stress leak and urge leak. And depending on these types, we can really talk about their management. There's a very rare occasion where leaking is continuous related, or it is caused by abnormal connection between the bladder and the vagina, or the ureter. The ureter is the tube between the bladder and the vagina, so the bladder and the kidneys. So if there's any abnormal connection between this ureter and the vagina, we call it fistula. And this is mainly after surgery. A long time ago, it was associated with prolonged labor, obstructed labor. So the first treatment of these conditions is surgery, just closing this abnormal connection. But if you talk about, if we focus about stress incontinence and urge incontinence, the first line of management of these two is really manipulating lifestyle, is talking about how we can change our life, how we can modify things which we can do it, and with the help of the patient easily, and we could really make up to 60% of changing in their problems. So the first thing is we talk about fluid intake. So a lot of women, they have a very large fluid intake. Their intake depends on more caffeinated drinks, so caffeinated tea, caffeinated coffee.
Coffees,
and
yeah.
Caffeine is very irritant to the bladder, and especially if the caffeine intake per day is more than 400.
What about tea? Is a tea is quite common, or is it milder? There was a small technical problem. I mean, we lost our speaker. He will come back to us quickly. Fadi, okay, you're back. All right?
I'm back, yeah.
Oh,
yeah.
Sorry. Must be the internet connection. Anyway, that's great.
No.
How about tea? Does tea has the same effect as coffee?
Yeah, any drink with high content of caffeine will cause the same problem. It's the caffeine in this drink.
Okay, excellent. Yeah, please go ahead with your how you're explaining about the management, and we should not take too much caffeinated drinks. Is that right?
Yeah. So evening drinks, we need to minimize evening drinks. If the weight is too much and the weight is high, then reducing weight will help. Again, like avoiding constipation, avoiding smoking. This is very important to really.
So smoking again, it comes in almost every program. If somebody comes out with smoking, last time we talked about back pain, and they said about smokers have a higher chance of back pain, and here we go. Now you talk about urinary incontinence, and you say there's a high possibility they will have. Smokers will have higher possibility of urinary incontinence. Is that right?
Yeah, I mean, on the bladder surface, there's some receptors called nicotinic receptors or muscarinic receptors, which would be irritated by high levels of nicotine in the blood. So the same for caffeine, it irritates these receptors and it causes more leaking problems for them.
That's quite interesting. Okay, now we talked about the general how to prevent it. Let's talk about what kind of help we could give them, like what kind of treatment option.
So usually this first line of management will be done in a primary care. So usually primary GPs will have some pathways. They will see the patient, they talk about them, and they will refer them first line management to have some either bladder retraining or pelvic floor exercise. So either they will go to continence advisor or they will go to pelvic floor exercise. So pelvic floor exercise is very important because it will help to minimize your leaking problems, and it will help you even to prevent this leaking if you continuously do this pelvic floor exercise.
So the pelvic floor exercise is an important one, isn't it? Let's explain them how how they could train pelvic floor exercises. There's a lot of videos on the YouTube as well. You can always follow there as well. And let's show them what we prepared for them on pelvic floor exercise.
Perfect.
Now I'd like to introduce Laura Ero, a physical therapist with Kaiser Permanente. She'll explain how you can exercise and strengthen the pelvic floor muscles. She'll also give you some tips on lifting techniques to help with stress incontinence.
Thanks, Sue. No matter what type of incontinence you have, the stronger your pelvic floor muscles are, the more bladder control you have. That's why it's so important to exercise these muscles. In the 1950s, a physician, Dr. Arnold Kegel, developed an exercise for women to help with incontinence. Known as the Kegel exercise, it targets specifically our pelvic floor muscles. What makes this a little challenging to demonstrate to you is that unlike other exercises we do for our body, this one deals with muscles that you don't ordinarily think about and certainly are not obvious to the eye. So the first challenge is to locate the correct muscles. One suggestion I have is the next time you go to the bathroom, try stopping your urine flow by contracting your muscles. You'll know if you were successful in isolating the pelvic floor muscles if your urine flow slows or stops. This is just a way to get familiar with the muscles. Try this once or twice, just to locate the muscles. Repeating this more often can actually make matters worse. Another technique for locating the correct muscles is to insert your finger in your vagina and try to squeeze the muscles around your finger. Your finger should feel a slight pressure around it from the muscles. It is very important that you feel confident that you have isolated the correct muscles. If after trying these two methods you still feel unsure, don't hesitate to discuss this with your healthcare team. Now, you're ready for the Kegel exercise. Start by lying down. Find the pelvic floor muscles and simply lift or contract them for 10 seconds. Now ask yourself, am I feeling my stomach, buttocks, or thighs tensing up? If the answer is yes, take a deep breath, and as you exhale, let those areas relax. You should only be lifting your pelvic floor muscles, and keep breathing. Don't hold your breath. Now that was one repetition. The conditioning program requires you to do this 4 times a day. Each exercise session should include 10 repetitions, holding each contraction for 10 seconds, and then relaxing for 10 seconds. And you will need to do this every day for 2 months. As you get better at this, you can progress to doing them sitting and finally standing. I know the Kegel exercise is a very small muscle contraction, but I assure you, if you follow this plan for 2 months, you will see a significant improvement in your bladder control. After 2 months, you can cut back to a maintenance program. This is, you perform these only twice a day, but still doing 10 repetitions and still holding each repetition for 10 seconds. One more point. Women with stress incontinence often express frustration that they can't lift anything without leaking urine. Doing the Kegel exercise will really help you with that. And before you do lift something, just stop and consciously tighten your pelvic floor muscles. Then lift. You'll feel the difference. Now, Sue will talk about controlling urge incontinence.
That's great, Fadi. Look, do we have a magic tablets for this?
So if it is urge or overactive bladder, then yes, we have some tablets. There's different kind of tablets we could use. They do have some side effects, mainly dry mouth and some blurred visions, but this will not really stay for longer time. And they do help by 70%, especially if we join the pelvic floor exercise, bladder retraining, they do help too much. This is slightly different from stress incontinence, because stress incontinence, the main treatment is surgery. And there's different modality of surgery.
Yeah, we'll talk about the surgery later. So there are tablets as well, and people can use for that. So anyway, if they have any of these conditions we talked, is first choice you should go to a GP, talk to them, and they will refer you to the right channel. Okay, let's talk a little bit about surgery. What do you do there for surgical intervention on this?
So surgery for stress incontinence has different types. There's invasive surgeries and there's minor surgeries. So it really depends on what's the counseling between us and the patient. So we talk about different surgeries. The small kind of surgery, we can inject some materials in the tube patient went through called collagen. We will narrow this tube, and that will help to reduce by 60%. The problem with this, it may not last longer time, and the success rate of cure is only 60%. The more invasive one is to, like when we do hysterectomy, we open the tummy. Sometimes we take a strip of tissue underneath the skin, and we can use it a hammock mechanism to support the tube the way through. And the cure rate with this one could be up to 95%.
Up to 95%. That's an amazing success, isn't it, for a surgery?
Absolutely, absolutely. It's a quite common surgery. There's different type of way we do it. Of course, there's different type and different modalities of surgery we can provide the patient. But again, it is something we can do, something we can help the patient.
Amazing. Okay. How frequently you do these surgeries?
You're talking about probably per month. You're talking about different type of surgery between 5 to 10%, 5 to 10 patients every month.
And after surgery, do they come back to your clinic, and how satisfied they are?
Yes, we do see them in let's say if we are doing a minor surgery, we see them in 6 weeks. If we are doing a major surgery, we see them again in 6 to 8 weeks. We can really assess how successful the surgery, and then we can take it from there, because the minor surgery, we can repeat it again in 12 months' time.
Okay, so minor surgery. So, yeah. So it can be done in the day surgery unit as well. So they come the same day and have the operation and go back. Do they need an anesthesia for this?
No, the minor surgery is under local anesthetic. So
that's the injection.
I will do it in 5-10 minutes. They will have the local injection, okay. And then immediately the 3 injection we do, and then once they will able to weigh twice, then they go home immediately within a few hours. They don't need general anesthetic. There's another type of surgery we could do to overactive bladder when we really do a lot of things and they fail. The simplest one is to inject Botox inside the bladder.
Botox inside the bladder, yeah.
Botox. The same Botox we use for cosmetic things. We sometimes can use it for leaking problems. It does help by 70%, but it does comes with some risk of really retention. So 10-20% of the patient, depending on the dose we inject, they may have some retention. This is why we teach them to really self-catheterize before we do any surgery. Any major surgery for overactive bladder or urge, it's really very rarely done because it has a lot of really complications. So we rarely do surgery for urge incontinence. The surgery is mainly for stress incontinence.
What's the best treatment for this one? This stress incontinence. What is it called? Cough or sneeze, and they leak urine. It can happen in young people as well, isn't it? It's quite
absolutely
quite important thing.
Yeah. So. The main line, if they are young, they have not completed their family, is to focus on pelvic floor exercise and manipulating lifestyle. If they have completed their family and they are not having any benefit of any first-line management, then surgery. Surgery can give them cure rate in the major surgeries, in the invasive one, up to 95%.
So surgery, so even the young people can have surgery, and it is
absolutely,
it gives a good results. Fadi. That's an amazing talk. I think we have covered all spectrum of urinary incontinence, and our viewers would have had a good knowledge, and probably you're going to talk to your family and friends and show this video and what we talked about, and if they need help, and of course they can go through the right channels and they can get to a gynecologist like you in the end, and they will treat the problem, so they don't have to be ashamed about it, or they don't have to feel guilty about it.
No, absolutely no need for this one. It's like any other medical problems. There's no shameful, there's no fear of guilty. We can do a lot to help people.
Thank you very much, Dr. Fadi Al-Faheli, and it was a great talk, and we'll see you in a quite civil episode next time. We need to talk more gynecologic subjects, and a lot of people waiting for it. Thank you very much for being with us.
Thank you very much. It's my pleasure anytime.
And by the way, thank you for staying with us on ION's Health Talk with Dr. Akram. If you have any further questions, please email us healthtalk@iontv.co.uk or message us on Facebook or Twitter, and we will respond to you as soon as we can. But for now, goodbye and keep yourself safe. Thank you.